Sometimes the shedding of organisms is intermittent. That means it's not always there. The case in point is endocarditis, which is an infection of the heart. This is actually the valve inside your heart. These things here are the bacteria growing on it. And if you think about your heart, it's going boom, boom, boom. That's what the valve is actually doing. And when it's shaking around like that, every now and then little bits of these bacterial vegetations are going to fly off into the bloodstream. And the idea is you want to get a sample when that bit flies off into the bloodstream. Now this isn't always going to be easy to tell. Most of the time, the patient will show a peak in fever because there's suddenly a whole lot more stuff in the bloodstream. So they might ask you to take the sample when there is a peak in fever. Otherwise, they might just ask you to take 3 samples in the hope that one of the 3 samples will happen to turn up at the right time. Another reason to take 3 samples, though, is also to exclude contamination, because if you did just 1 sample, it may be more likely to be a contaminant introduced. And we'll talk more about contamination later. This is actually what the bacteria look like inside the blood. These things here are your normal red blood cells. And this is actually, I know it looks like a love heart, but that whole thing around there is actually a white cell, and all those little pink dots are bacteria within the white cell. And you'll see, there's obviously a few loose bacteria that haven't been gobbled up by white cells too.
We use 2 bottles. One anaerobic with no air present in the bottle, and the other one aerobic, which has air in the bottle. Blood cultures are always first in order of draw. They come with 2 bottles in a set. We always do the aerobic bottle first because we use a butterfly during this collection. We always do the aerobic first because of the air in the tube. We're going to be introducing air into this bottle and it won't sacrifice the test. If we were to put the anaerobic on first, we would introduce air into that bottle and the test would be compromised. Blood cultures are used to detect bacteria in the bloodstream. Clean your patient's arm with some alcohol. Start in small circles and gradually get bigger for 30 seconds. We're then going to clean the arm with some iodine. Same technique, and again for 30 seconds. Get rid of your dirty gloves. Put your needle together. And we're ready to go. press there. Now label the jars with their essential points of identification, and time and date of collection is really important. When placing your lab number, it's really important not to cover the barcode that was already on the bottle. So just place it on a space where there is no barcode.